Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, varicose veins can be vexing. We'll help you get a leg up on this often painful problem. Then, we'll preview an exhibit on the evil power of Nazi propaganda. We'll offer thanks for the wonderful ways to create a beautiful smile. Plus, we'll volunteer information about the many ways older adults can be of service. And little-known tax breaks when you hire a caregiver.
It's time to get geoing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Your legs ache when you stand for a long time, or they feel so uncomfortable when you're trying to sleep. Sometimes you feel an itching or burning sensation in your legs. But all that's normal, right? Not necessarily. According to Dr. Meryl Moyes, these are symptoms of varicose veins. What can you do about them? She's here to tell us. Dr. Moyes is an attending surgeon with Metro Health. Welcome to the show.
Thank you.
Now, I thought varicose veins were those little red veins you get on your legs that you can see, and they're just when you get old. And I mean, is that what you're talking about with varicose veins?
Well, varicose veins falls into the large spectrum of venous disease. So you can have problems with your veins and symptoms associated with that without having those visible veins.
Okay.
Some people have the smaller spider veins, other people have those large ropey veins, and other people just have tired, achy legs.
So those are the symptoms, and we're talking about this disease, so it's the aching legs, and what are the other things?
Achiness, soreness, fatigue. Some people get painful cramps, Charlie horses in their legs.
Okay.
At night, other people just get pain and irritation right where the veins are. It can either cause burning, itching. Some people describe ants crawling up and down their legs.
It's kind of hard to ignore then. So why do these things occur? What's going on?
Well, as people age, they can develop problems with their veins. Other reasons could be pregnancy. A number of people will not have any veins, and then after pregnancies will find that they've gotten a couple of other things besides the baby.
They're everywhere. So what's actually going on in the veins?
So the job of the veins is to bring the blood up from the extremities up towards the heart. And there are valves that sit in your veins that help to keep the blood up. If those valves are leaking, the blood just pools back down and causes those veins to become dilated and enlarged over time.
So that's what you can see when they're closer to your
Closer to your skin, right.
All right. Is it only in your legs, or can this happen anywhere?
Mostly in your legs, because that's the most dependent part of your body. Gravity is kind of working against you in the legs.
Yeah, that would be true. So is this just simply aging, or are there other factors really involved? I know you mentioned pregnancy, but anything else going on that?
Well, it mostly occurs in women than in men. Pregnancy is a factor. Weight gain is a factor. High heels, actually, can also cause problems with the veins later on in life.
How about crossing your legs at the knee?
No, that's in the legs too.
And my teacher told me that when I was just a kid, so I always cross at my ankles now. So, are there options to treat these kind of varicose veins?
Yeah, I mentioned the various different symptoms, but not everybody has symptoms, and not everybody needs to be treated. They're not dangerous. So if you're not having any symptoms, or if your legs don't bother you, they don't necessarily need to be treated. If they do cause symptoms, the first goal of therapy is compression stockings.
Oh, okay.
And they generally will help.
Simple.
And they generally will help 2/3 of people who have problems with their veins. Compression stockings are all you need.
Okay. But when the blood is pooling, it's no risk of clots or anything from the veins. Is that correct?
Well, you can get some superficial clots, but those are not the dangerous clots that are going to travel to your lungs.
Okay.
They can be tender and painful, but they're not dangerous.
Anything besides just if it gets worse or it's really giving you problems and the compression socks and any other treatment doesn't help, is there some other option?
There are. So if compression stockings aren't alleviating your symptoms, or they're very difficult to get on, or if the cost is prohibitive, there are some options. They can involve anything from surgery, from vein stripping, physically removing the vein, or they can involve injecting the veins with medication that causes it to collapse and clot off, or if it's a larger vein involved, it can involve a procedure called an ablation, placing a catheter that causes the veins to collapse and go away.
Oh, okay. So it's not horribly dangerous, very uncomfortable probably, and there's treatments.
And it can
we have options. Excellent. So whether you see enlarged veins in your legs or not, if you have the symptoms Dr. Moyes described, you could have varicose veins. And you don't have to endure your leg pain in vain. To learn more, use the information that's coming up next. My thanks to Dr. Moyes for joining us today.
Thank you.
To learn more, call Metro Health at 216-778-7800 or log on to www.metrohealth.org. Next, how will the Nazis disperse their deception?